Beti Thompson is a member and an associate program head at the Fred Hutch Cancer Research Center. She says while minorities are just about as likely to have cancer, they are more likely to die from cancer.
The disparities are less in terms of incidence, that is the number of people who get cancer, and more in terms of mortality, the number of people who die from cancer. So even though for some cancers the incidence rate is higher for minorities in the underrepresented population, the rate of dying from cancer is much higher than it is for non-Hispanic whites.
Thompson says there are many societal factors that influence this.
It's not enough that an individual makes a decision to change his or her behavior, but there are things that affect how an individual behaves, like poverty. And poverty is much higher for Latinos and for Native Americans than it is for non-Hispanic whites.
Thompson says lower insurance rates, lower levels of education, and cultural conditions also contribute to high mortality rates.
When we look at medical providers, we've seen that medical providers actually spend less time with minorities, African Americans, Latinos, than they do with their non-Hispanic white patients. And this just isn't right, because there may be language problems, there may be literacy problems and so forth, and to simply shunt those people aside is not going to solve the problem by any means.
Thompson says community groups need to work together to provide the necessary information on cancer screenings to those who need it.
With diverse communities, it's a matter of trust, it's a matter of partnership, it's a matter of collaboration and belonging. And it isn't until we do those kinds of activities that they are willing to listen to experts who have some opinions on how they can improve their lifestyle behaviors.
Thompson says money also needs to be invested in providing preventive care.
When it comes to chronic diseases, prevention is the best way to reduce health disparities and to reduce incidence and mortality. And so many chronic diseases are affected by the same kind of lifestyle behaviors such as diet, physical activity, screening, etc. So prevention is definitely where it's at.
For KRWG, I'm Samantha Sonner.